And each plan has different benefit levels. So typically, the more comprehensive the coverage, the higher premium these plans are going to cost you. Medicare supplements are regulated according to federal and state laws, and they're required to offer the same coverage. These are your Medicare supplements, well known as Medigapps. And the cost, depending on the Medicare supplement you choose, some of or all of your out-of-pocket costs for care under the Medicare A and B are covered. Okay, premium prices with different insurance companies may vary sharply for the same coverage. In some plans, premiums rise as you get older, so your premium goes up, increases. The enrollment, you are guaranteed the right to buy a Medicaid plan during your open enrollment period. Some states, if you apply after the enrollment, they can deny you for coverage. And they may have to, based on your health, because they'll make you take a physical. So they can deny you. So the coverage, they have no network restrictions, no referrals required. Coverage may go with you wherever you move or travel, even some are outside the U.S. They have the foreign travel coverage for emergency service. And also, coverage is guaranteed to continue as long as you're paying your premiums. If you start paying your premiums, they will deny you. These are the Medicare supplement insurance plans, and these are all provided by private companies. Let's talk about the enrollment period for a little bit. On the Part A, when can I first enroll for Part A? Anytime after you're 64 years old and 9 months or older, or otherwise become eligible for Medicare. Enrollment will be automatic, the Part A, if you're already receiving Social Security benefits. Otherwise, you'll have to enroll at your Social Security Administration office. Now, what if I'm late? Generally, there's no penalties for signing up for the Part A. You may pay penalty on your premium for signing up late if you are one of the people who pay monthly premiums on Part A because neither you or your spouse contributed enough to Social Security. Now, we as individuals, we're working, most of us work. As you work, you're paying for your Part A because it's being deducted out of your check. By the time you're eligible to turn 65, that Part A is already paid. But some people, a lot of them are, a lot of individuals staying home, they're stay-home moms, or they just came into the U.S., became a U.S. citizens. They have not worked enough into their quarters, so they don't qualify for Part A. And this is what it means, that if you don't qualify for Part A, you can purchase it, but there's no penalty because this is on the Part A. Now let's talk about the Part B. On the Part B, when your enrollment window is, for most, is 3 months before your birthday, during your birthday, and 3 months after your birthday. So you have 7 months to enroll with the Part B. The B is your doctors. So what happens if you're late? Say you're thinking about it, well, should I enroll? Or time flies, you get distracted, your enrollment period's over, you're on your 8th month, you didn't sign up, then the penalty kicks in. You can sign up, but you're going to pay 1% penalty.
I have a question. What if you do not sign up and then the following year the enrollment period comes? Would you still pay that penalty?
You need to sign up in that initial. They give you 7 months. 3 months prior, then during your birthday month, and 3 months after. We always encourage people, sign up as soon as you get that paperwork in, because it'll be sent to you from the social administrations on the Medicare, because you're going to be getting closer to your age 65. You're giving you 3 months. We're going to give you your full month at your birthday, and then 3 months after, we're still giving you more chance. But once you go through that, after that 7 month, then the penalty starts. So it's very, very important to keep in mind on that. And the Part C, which is your Advantage plans, generally for most, you can first enroll 3 months before your birthday, during your birthday, and the 3 months after, just like the Part B. So you can do both. Sign up for Part B and C, and then at least all of that is done. Now, if you do not enroll, then you're going to face the same thing. If you miss the open enrollment October 15th to December 7th, then you have to wait till the next year. So you'll be responsible for that 20%. So keep in mind, you work with consumers who are aging in or getting confused. Please make them aware about the 7-month window. Did you have a question? No?
Basically, this is true for Medicare Part B, C, and D, right?
Right.
A.
Yes, and D, which is your prescription as well.
Okay.
Because remember, the Part D is not an automatic. You have to do it yourself. And they do have the same open windows. Okay. October 15th to December 7th is the enrollment period. Now, a little bit on the Patient Protection and Affordable Act, PPACA for the acronym, Medicare Renew. Medicare Renew is a book that you get every year, and it's probably out. I don't have one with me, and it's only strictly information on Medicare. This booklet is mailed to everyone from Medicare, and if you don't have one, you can call Medicare and they can mail you one. But this is a wonderful booklet that has all your answers to your questions to Medicare, and it comes right from the Medicare administration. But enrollment days changed. The 2013 enrollment period is going to continue October 15th through December 7th. A few years ago, it was November 15th through December, so it was a longer period. So it's shorter now. So you need to glue those dates, make people aware. You've got a short window. The coverage gap, known as the donut hole, is gradually being reduced under this Affordable Act care. So that's what they're focusing, is to reduce that donut hole, which will be wonderful because a lot of people their fixed income, but they need the prescription. Also, before this act came into place, Medicare beneficiaries were responsible for a majority of their prescriptions when they went into the donut the gap. They had to pay 100%. And in the first 6 months of the year, more than 1 million seniors and people with disabilities saved $687 million on prescription drugs during the donut hole because of this act that was implemented. In 2013, beneficiaries will pay 47.5% for the name brand drugs and 79% for generic while they're in the donut hole. Also, the coverage gap. These discounts will gradually decrease every year until it is completely closed in the year 2020. So many beneficiaries who have original Medicare now qualify for an annual wellness visits. This is another part of the PPCA. And many of these preventive services, such as tobacco cessations, counseling, medical screenings, are all free. Remember, you used to only have a physical once you age in. Now it's every year, preventive, which is wonderful. Yeah, and there's a whole list of preventive exams that you can get free. Okay, and moving along, you have the options to reserve all these benefits under the PPACA. The law did not reduce or eliminate any existing guaranteed benefits, and beneficiaries may still compare original Medicare and original Medicare and Medicare Advantage plans to find the coverage that is best for them. So you really have to see what's best for you. Also, call, reach out. There's a lot of programs that will show you who you can reach out to in a few minutes. If you have questions, you get confused. But make sure that your coverage that you need gets fulfilled. Enrollment in Medicare Advantage has increased since the Act was signed into law. So we have a lot of consumers under the Advantage plan. They're looking more into it because of the 80-20, that could total out if 20% falls under your responsibility with one admission to the hospital if you don't have an option with a medical supplement or an Advantage plan. So here are the steps. This is a review. Review on the enrollment. Understand when you qualify for the coverage. Secondly, research. Compare plans and find the coverage that's best option for you. Everybody has different needs, so there's different options. Ask questions, as I had said before. Important questions about your medical needs, such how much prescriptions do you take regularly, frequently, do you need care, extra care. Those are the questions you need to ask your plans or whoever your options you're looking for. Number 4, get answers. Locate free resources to answer all your Medicare questions. Visit the Medicare madeclear.com. There's a website. Also Medicare.gov, or call the Social Security Administration website. You can go into that, and you'll get a lot of answers in the internet. Find financial help. See if you qualify for financial assistance program. Contact local Social Security or the state Medicaid office, and that would be for the Medicaid. A lot of people do not know that they qualify for one of these extra savings, not unless you apply, and that's very encourageable. The only thing they can do is say, no, you don't qualify. But what if you did qualify, right? That would be a great savings. So see if you can find financial help. Also enroll. Once you know what plan type is right for you, go online on Medicare.gov. Find your plan the plan finder to see which plan is available in your area. Also, if you call 211, you can also request to be connected to the Area Agency on Aging. Those are your SHIP programs. And they have the plan finder where they can assist you find the right plan for you. Of course, they'll ask for your zip code. They'll give you your options. You get phone numbers, then you can call each one and see which one's going to be your best fit. And then lastly, yearly review. Mark your calendar. Make any changes in your plan during the Medicare open enrollment, October 15th through December 7th. You want to look at what you have right now to see if it's still working, there's no changes, then you don't have to do nothing. But if you are with something, oh, now I need glasses, I need dental cleaning, I need transportation, so your needs increase, but where you're at over here is not being provided. So there's where this time frame, October 15th to the 7th, is giving you time to search and switch. But if you wait after, you can switch, but you can disenroll only. You cannot choose a plan anymore.
That's
so these
true.
dates are very important, yes.
That's true every year.
It's every year.
Okay.
Every year. So I want to thank you for your time. I know there's a lot of information, and this is just the Medicare part. We didn't even cover the Medicaid. That's another story. But Mr. Phillips, feel free to call me if you have another site that they're interested in knowing about this program. I'll be more than happy to come and bring it to you. It is complex, it is confusing, but please ask questions. Reach out to Medicare.gov. There's an 800 number in your books as well, where you can call the Medicare offices or the Area Agency on Aging. They're everywhere. They come and do presentations as well. And we work closely with them because we have the same focus. We want people to make sure that their health plan is providing all their medical needs.
Okay, the new health care plan, as far as seniors are concerned, it's basically about that donut hole. That's the only change.
Right, that it's decreasing, and the preventive exams that they're getting, their physicals, because if they go in and get their mammograms or physicals, they can find it at an early stage and start treating it as cost efficient. Before, they never had those pre-screenings before.
Okay, and the reimbursement rate on the Part D is 79%?
Right. And every year it's 79% for generic plans.
Okay, for generic.
Now for name brand is 47.5. It used to be where they used to be responsible for 100%.
Okay. And that discount's going to increase until it closes to 2020.
Exactly. So every year they're going to hike up that percentage where the consumer will be responsible for less.
So
less and less of their.
Okay, and then the preventive medicine was what was the benefit?
The preventive screening exams is like now you can get the tobacco screening, you can get help with that if you want to quit smoking. Prostate cancer pre-screenings, mammograms, physicals every year. It used to be only once when you came in. Now it's every year. Okay. So all of that's new, and there's a whole list of preventive exams in the Medicare and You booklet that everybody gets. All the consumers who are on Medicare will get one. If they don't receive one, you can call or go into the Medicare.gov and have one mailed to you.
Good.
But it has a breakdown of all the physicals, and there's a long list
Okay.
of preventive exams.
Well, I want to thank Delilah for coming to talk to us today. Any questions? Thank you so much.
Thank you, sir. Appreciate it.
Appreciate it.